Sa male, of course, nawawala yung uterus and the vagina. So we still have the bladder and the rectum. So what pouch is this one? Recto vesical pouch. Although walang masyado ding clinical significance kasi hindi naman natin ginagamit to for diagnostic purposes. No? Ang may clinical significance dito with the rectum would be the location of this gland, the prostate. So that when you do a rectal exam, you can actually palpate that. Kasi ito, nagbabulge siya actually dito. By less than a cm. Nagbabulge siya by less than 1 cm. If it's more than 1 cm, you will diagnose it as prostatic hyperplasia ba or trophy?
Trophy, sir.
Ano ba ang difference ng plasia sa trophy?
Trophy malaki.
Increasing cell number yung plasia, sir.
Hyperplasia.
Some says it's hyperplasia, some says it's hypertrophy. So it's benign prostatic enlargement na lang. So let's go. Bladder and then urethra. Ito yung urethra. Okay, so it has actually medyo confusing ang kanilang mga naming of the urethra. Some says there is a bladder part, vesical part, pero hindi na mention in other anatomy books. And hindi ko nabasa yung more ninyo kung what does it say about the vesical part, no? Pero I believe that there is a vesical part also. So most of the time, ang kanilang definition of the urethra would be a prostatic part, a membranous part, and a penile part. No? Yung penile part pa, divided into spongy, and then what erectile body is this again? Ito yung corpus cavernosum. Ito, spongiosum. So, bulbous part and a spongiosus part. So, ito yung sabi nila, what is this part? Dilatable and most or widest part. And ito naman yung narrowest part. Because ito yung deep perineal space naman dito. Doon sa female kanina, the white thing, no? So, meron din siyang superior fascia, meron din siyang inferior fascia, and merong sandwiches, sinasandwich niya yung muscles, which is the sphincter, urethral muscle again, and you have around this area yung deep transverse perineal muscle. Okay? So, ito naman yung superficial perineal pouch. Okay? So, ano yung mga contents ng superficial perineal pouch on sagittal, mid-sagittal section? We can only see the bulbous part of the corpus spongiosum or bulbous part of the root of the penis. Kasi siya yung nasa gitna, no? Nakikita niyo may triangle, tapos meron sa gitna. So, ito yung bulbous part. Hindi natin supposed to be yung Cowper's gland is located in this area, no? Nandiyan yung Cowper's gland, but it will have its duct piercing the urethra on the superficial perineal pouch. So, corpus spongiosum, and it will dilate into the most distal part, and that will be called your glands of the penis. So you can see the urethra passes through only the bulbous and spongiosus part. Yung the remaining part of the penis would be your cavernosum, no? Corpus cavernosum. So anong muscle yung supposed to being magko-cover dyan? Ischiocavernosus, dito bulbous spongiosus. So you can see yung cavernosus part will only be up to this area. It does not form part of the glands of the penis. Meron pang isang part yung urethra, which they call also as a dilated portion. Ito yung navicular fossa. Dilated portion inside the glans penis. Ito yung skin called your prepuce. No? Prepuce of the penis. Pagka hinati yan, pagtatahiin itong dalawang to. And on the other side also. And you have a circumcision.
Muscle dito na part.
Wala na. No more muscle there. Prepuce. P-U-C-E. P-R-E-P-U-C-E. So scrotum, testis, and epididymis. Wala na. Okay, let's make it, ano ba makikita natin dito? That should be your, eto, ano to? That's the spermatic cord. Ito yung ureter. That number 13 there is ureter, and that number 18 there will be your spermatic cord. So nothing more to see. Let's make it 3D. Ito yung testis and epididymis. Okay, so you have the whole scrotum there, testis, epididymis, and you have the testicular artery and testicular vein. No? So, production of sperm, storage in the epididymis, and then afterwards will travel through the spermatic cord. Spermatic cord will pass through the external inguinal ring, and then actually magta-travel siya a little side view and will pass through the internal inguinal ring, and then be located intraperitoneally, and then will cross the ureter and will meet the what do you call it? Seminal vesicle to become the ejaculatory duct. Doon. So that ejaculatory duct will pierce the prostate. Ito supposed to be on. Yung ejaculatory duct. No? So ejaculatory duct and will join the urethra. Hindi na nakita yung piercing niya kasi galing sa side no? Dalawa kasi yan no? So galing sa side, so hindi na nakita yung piercing. But this should be the ejaculatory duct. Okay na ba? Same. No? So, pwede kong pakita tong ganito din. No? Na-identify nyo pa ba?
So ito na lang.
Hindi, kasi kulang ng...
May number na lang.
kulang eh.
Basta 13 is spermatic cord.
Ito pa rin yung urogenital diaphragm or the deep perineal space. Okay? Bulbus spongiosus, ischio cavernosus. Okay, tapos na tayo.
Muscle to.